Hello, this is Dr. Gay from First Sick MRI, and this is a 30-year-old male with complaints of knee pain for about 3 weeks. He's a runner, and on this view we can see that there is a difference between the medial meniscus, this little black wedge. It's a shock absorber between the femur and tibia here. This medial meniscus looks pristine, but the lateral meniscus does not. There's a horizontal band of brightness right within the meniscus. On this one we call it a T1 weighted view, where subcutaneous fat is bright, marrow is bright. On this view the signal is more intermediate signal, but we can see that this is abnormal and the medial meniscus is normal. Again, the medial meniscus is normal, the lateral meniscus is abnormal. So at first glance you might say, wow, this is a meniscus tear. Look at that clear abnormal signal in the meniscus. But a meniscus tear by definition must touch the top or bottom, the superior or inferior articular surfaces. So if a surgeon went in to look, they would see that the tear would contact the top or bottom for a true tear, but this does not. It's right in the mid-substance, and so it's not a true meniscus tear, and we call this degenerative signal of the meniscus, or mucoid degeneration. It's just a breakdown of the substance of the meniscus, and sometimes this can break to the outside and spill out, and we have fluid collections developing along the peripheral rim that may communicate with this. We call those fluid collections parameniscal cysts. But right here we see just the meniscus has an abnormal signal within the substance. Sometimes the meniscus may be expanded a little bit, maybe kind of plump. And in this case there's no significant increase in volume of the meniscus. But this is a side view. Here's the front. The anterior horn looks normal. This is in the back, the posterior horn. We see that bright signal right in the mid-substance, not contacting the top or the bottom. Here we go, top, bottom, pristine, and there's that abnormal signal right in the substance. So this is an example of mucoid degeneration of the meniscus, not to be confused with a true meniscus tear which contacts the top or bottom. And I showed a case of this 1 or 2 weeks ago, so I just want to show another really quick case of abnormal signal in meniscus that is not a meniscus tear, but rather mucoid degeneration.